Just when it seems like the war against COVID-19 will soon be over, the Hydra-headed monster has continued to prove its potency, mutating more strains. In Nigeria, the story is the same, as the country is presently experiencing the fourth wave of the virus with the new strain, Omicron. The present skyrocketing nature of the virus recently has continued to be a source of concern to many, especially at this season of festivities. Just 3 days to Christmas, Nigeria recorded 2,123 cases, and this has kept many worrying about how the country will celebrate the festivities in the midst of the rising cases of the virus, putting in mind the preventive measures meant to be kept by all. As people are already traveling to their various destinations for celebration, how should they celebrate amidst rising cases of COVID-19? Also, how possible is it to observe the stipulated COVID-19 preventive measures? These are some of the questions our guests will be answering on this edition of Nigeria Today. My name is Lydia Odije Ochi. Compliments of the season. The topic is festivities amidst rising cases of COVID-19. And my guests are, in the studio, Dr. Isaac Egboja, a public health analyst. You're welcome to the program.
Good evening, public health specialist, not analyst.
Public health specialist. Welcome to the program.
Thank you.
Joining us via Zoom is Dr. Sadiq Abdurrahman. He is the Acting Director, Public Health Department, FCT. Thank you for joining us.
Thank you for having me. Good evening, viewers.
Okay, let me begin with Dr. Egboja. Why do we have this sudden rise of cases?
Well, this particular variant, the Omicron variant, is more transmissible, meaning that it transfers from one person to the other more easily, much easier and quickly than the previous variants that we've had. And this is one of the reasons why there is a sudden surge of the virus.
Okay. Now, Dr. Sadiq Abdurrahman, do you have a divergent view on this, on the reason why we have a sudden increase?
Not at all. Rather, I will reiterate what my colleague have just said. We are witnessing yet another variant of concern as declared by the World Health Organization called Omicron. It is scientifically proven with the available data that the Omicron as variant compared to other variants is about 50 to 60% more infectious and more transmissible than the other variants of the COVID-19 so far. Okay. So this might couple with the fact of people not complying with the non-pharmaceutical measures that are already being instituted and are ongoing could significantly contribute to what we are seeing today.
Okay. Dr. Egboja, how well are we doing to curb the spread of this virus?
Well, not well enough. We are trying, but not well enough. You recall that for some time now we've been emphasizing that everybody should be vaccinated against coronavirus. While some people have responded well and have taken the first and second doses of the vaccine, others have not even made any attempt at all, which is unfortunate. Not too long ago, about a week ago or so, we heard that some vaccines expired, and that means that they can no longer be used. One of the reasons why those vaccines expired was because the demand was not as expected. If people were rushing to the health centers, to the facilities, to the places where these vaccines are given, the ones that are expired wouldn't have expired. We would have used them. The population is here. That's not the problem. But the willingness to go and be vaccinated is the problem. And this is one of the things that we need to do, we need to attend to and do better. So in that regard, we are not doing as good as we should. Secondly, the non-pharmaceutical preventive measures that we have been talking about for over a year now, which are keeping a distance from your next neighbor, wearing your face mask, covering your mouth with your elbow when you cough, and so on and so forth, people are still not adhering to these instructions, to these simple measures, which are preventive in nature.
This is it's really posing a challenge, especially to what the government is trying to do. All the efforts government is putting in place to ensure that we curb the spread of the virus. Now, Dr. Abdulrahman, Christmas, just like every other festivity, is when people celebrate with their loved ones. How can it be celebrated while keeping safe from COVID-19?
Sorry, can you come again? I couldn't get your question.
Yes, I said Christmas, like every other festivity, is a time when people come together with their loved ones to celebrate. Now, how can this festivity be celebrated and still people keep safe from the spread of COVID-19?
Yes, this is really a very big concern for all of us. Yet again, like the past two Christmas of festivities were marked in COVID-19. However, it is a global pandemic, and we are aware of the high level of transmission of this particular variant. Here we are, despite the measures that are being implemented, and we are yet to also go into such a festivity. We started witnessing geometrical rise in the cases. For example, in FCT, in the last 2-3 weeks, we witnessed about 3-4-fold increase in the cases of the COVID-19, as well as more than 6 times cases on admission. Meaning this is sending a signal to us. And most importantly, the population should also take note that the more we come together, or the more we don't comply with the basic fundamental protocols of physical distancing, keeping this physical distancing, hand washing, hand sanitizer, and most importantly, face masks, we are actually going to lead to explosion of this. The FCT government had put in place a lot of mechanism. It is an ongoing process. At the moment, we envisage that this is upcoming. We had precisely on the 20th, the Honorable Secretary for Health in FCT, Dr. Abubakar Tafida, as well as jointly with the Director of Media in the Minister's Office, had jointly done a press briefing. These are the process to step up awareness creation, step up the sensitization, in addition to the ongoing, which we are already doing now. Okay. And the access also for testing is being strengthened, is being increased to provide people with especially rapid testing to know their status, to take a quick decision. Okay. The earlier one knows his or her decision or status and self-isolate and keep away, that will go a long way to reducing the transmissibility.
Yes, thank you.
And most importantly, each and every one of us must take responsibility and adhere strictly. We don't have any other option as far as this variant is concerned. It is not differently from the variants of the same COVID-19.
It's okay.
So we need to strictly take responsibility.
Okay.
And
Dr.
ensure
Egboja.
that we don't lead to...
Dr. Egboja, as like he said, the FCT Administration of Health has taken its some measures to curtail the spread. Now let's talk about Lagos. Just like we heard in the news, as part of measures to curb the spread in Lagos, the Lagos state government has said that party invitees, you know Lagosians, they love to party. So invitees must present vaccination card or negative status report. How realizable is this? And should other states emulate this method?
Certainly, it may sound a little bit too drastic or too difficult to obey, but when we have a situation like this, what option do we really have? If people would do things that are simple, things that are preventive, things that will keep them safe, the need for those type of stringent rules will not arise. But when people are not willing to, the authorities have no choice. They have the responsibility to protect both those who know and those who don't know, those who are strong and those who are weak, those who are healthy and those who are sick, those who are more at risk than the others should be protected. And this is one of the reasons why they are doing what they are doing. Lagos has been very exemplary, let me say, right from the beginning of the epidemic last year. They have been very active, they have been very good. Despite the large population that we have in Lagos, they have been doing very well. And if they have started this, I don't see any reason why other states should not do the same. I would advise that they do the same and make sure that their citizens are protected. The authorities are not doing this because they want to flex their muscles, they want to show power. They're doing this because they have the responsibility to protect the public.
Thank you very much. At this point, we'd like to take a break. We'll be back to ask more questions on the program. Do stay with us.
This is NTA News 24 broadcasting from Abuja. You can watch us anywhere, anytime on the following platforms. For more information, log on to our website www.nta.ng or join us on our social media handles, Facebook at NTA News 24.
For comments, suggestions and inquiries, send an email to news24@nta.gov.ng or call us on the following numbers.
NTA News 24, news and more news.
Welcome back. The program is Nigeria Today, and we're discussing festivities amidst rising cases of COVID-19. And our guests have been Dr. Isaac Egboja, a public health specialist, and Dr. Sadiq Abdurrahman, Acting Director, Public Health Department, FCT. Now, Dr. Abdurrahman, you talked about measures that the FCT has been taking to curb the spread. Now, let's talk about the rural areas. Many people believe that with the festivities, more cases might be recorded in the rural areas. Now, do you share that opinion too?
Yeah, thank you very much. In addition to the already ongoing measures, we envisage the upcoming festivities. So we have reinvigorated measures.
Well, we seem to have lost the signal there. We hope to reestablish contact. Now, Dr. Egboja, I throw the question to you.
Yes. Generally, when people travel during this time of the year, when it is very dusty, it is very dry, and this is the usual time for what we call the flu, the normal flu that people have. Chances are that, first of all, people who are traveling from areas or places where the transmission of this virus is high and are going to places where transmission has been either very low or non-existent, are likely going to go and infect those that they meet unless they take preventive measures. First, when they are traveling, let's start from there. When you are traveling, you should please try as much as possible not to be crowded in a vehicle. Unfortunately, in practical terms, in our situation here, every vehicle traveling now packs passengers as if they are just animals, very close to each other. There's hardly any space. But there's something they can do. Rather than winding up all the glasses and having everybody almost suffocating in the vehicle, sometimes with very little air conditioner, it is advisable that you wind down and let everybody take fresh air. It may not be the most pleasant because it may be a little bit hot, and when you travel on high speed with hot air, it doesn't feel that good on the body. But I would rather do that than to stay in a vehicle where the same air is circulating and everybody is infecting the other. If there's only one person in the vehicle that is infected or that is a carrier, chances are that he is going to transmit it to others. And that's first step. Second step, when you arrive at wherever you are going, the usual hugging and kissing and so on should be limited. Then, of course, sleeping places. We all know in villages, people sleep with each other. They use one bed can take like 2-3 people. If there's a way of limiting that, we should try. Fortunately, at this time of the year, you can use mats. You don't have to sleep on a bed. You can put a mat on the floor and you'll be comfortable. In some places, the weather is very hot already, so the issue of you being cold is not there. In the northern part of the country, however, this time of the year is a very cold time, and therefore people would find it very difficult to sleep without blankets or without good cover or in an open place. And therefore, those people should also take good care. Make sure your windows are open, cover yourself, but make sure that there's good ventilation and be as less number in one place as possible. Those are some of the things, practical things that we can try to do. But let's come back again to the issue of prevention, the basic one. Apart from wearing your masks, you need to be vaccinated. We've been trying to pass the message that everybody needs to be vaccinated. Only a certain number has responded so far. I just talked about that a little while ago. We need to be vaccinated. In the case of the Omicron variant, if you have taken only the first shot, you are not covered. If you've taken the second one, you are not even properly covered yet until you take the booster. When you take the booster, then maybe this time now you are covered up to 75%, but not 100%. So if people who have taken the second dose are not 100% covered or prevented, how much more of those who have not taken any dose at all? Can I please beg Nigerians, go and take your vaccines. They are free, they are needed, they are preventive, they are useful to you and your relatives and your loved ones.
Thank you, Dr. Egboja. I'll still stay with you since we're here to re-establish contact with Dr. Abdulrahman. What is the level of awareness amongst rural dwellers about the Omicron variant? Dr. Egboja.
Well, the compliance you talked about.
The level of awareness in the rural areas.
No, people are not aware of the differences between the first type of variant we had, the Delta we had, and now the Omicron that we have now. But that's not even the issue. Even if you don't know anything, just know that there is a coronavirus in a rural area. If they don't need to know this variant or that variant and so on, but they need to know that there is danger. They need to know that there is an enemy. They need to know that there is death at their doorstep, and they need to prevent themselves. That's the more important message than knowing which variant we have now, which variant we had last. Yes, if you know those, that's good. There's nothing wrong with that. But even if you don't know, just know that coronavirus, irrespective of the variant, is a dangerous disease that must be prevented, and we must do all we can to prevent it.
Okay, now, still educators, how best do you think this Christmas should be celebrated?
Well, the best way to celebrate Christmas or any other festivity is to be conscious of the fact that you are not alone. you are moving around with a possibility of being infected, or that you have already been infected, of infecting another person, an innocent person, and more likely, even a weaker person. Recall that a lot of our parents that were going to visit in the villages are older than us, and their immunity levels are very low. If you are traveling from Abuja, from Lagos, from Kano, from Jos, from wherever you are, and you are taking this virus with you, for example, to the village, and you are going there to stay with your old parents who are frail, who are probably diabetic, who are probably hypertensive, who are probably suffering from cancer, or whatever disease, or HIV/AIDS, whatever, or tuberculosis, whatever disease, you are going there now to kill them, literally. That's what it means. And this is the reasons why we are saying that everybody must be conscious. And during festivity, yes, celebrate. Yes, be happy. Yes, rejoice. But do that conscious of the fact that there's an enemy within you and around you. And do all you can to prevent it. Wear your face masks when you are in the public. If you have to cough, make sure that you cough to your elbow. Make sure that you don't stay too close to another person. And wherever you are, let the place be ventilated. Very important.
Okay. Now, what more or what else do you think government should do in the area of enforcement to ensure that they curb the spread of the virus?
Well, the federal government has taken a good step by saying, if you are not vaccinated, you cannot go to your office. I support it wholeheartedly. And I'm sure every other health worker who is concerned and who has seen the danger that we have at hand will agree with that. I think that states should follow suit. Many states are folding their hands. They're not making noise. They're not talking enough. That's something that we should do something. The federal government has its own role to play. Most of the role that the federal government is playing should be more advocacy and setting policies, making sure that there are guidelines and so on. The real foot soldiers, the real implementers should be states. And these things should be cascaded down to the states, and states should be doing their own bits and making sure that they protect their own citizens, especially now that people are moving from one state to the other.
It's okay. Now we have established contact with Dr. Abdulrahman. Now, briefly, Dr. Abdulrahman, you heard what Dr. Egboja has told Nigerians about curbing the spread, especially at the rural areas. Now, to you personally, it's Christmas. How do you intend celebrating the festivities?
Yeah, we need to take responsibility. Government is everybody's business. Health is everybody's business, and government is doing its bit in areas of, providing us access to testing, providing us with the vaccines and the guidelines and protocols. So we need to all take responsibility. We need to get the buy-in, just like my colleague said, from federal, state, and local government and the community. And that is why at the FCT level, the government is putting in a lot at targeted community meetings, town hall meetings.
Okay, well, that's all we can take on the program today. We really need to appreciate our guest, Dr. Isaac Egboja, a public health specialist, and Dr. Sadiq Abdulrahman, acting Director of Public Health Department for the FCT, for the time well spent with us. We are really grateful. Thank you so much. And we wish you a Merry Christmas and a Happy New Year. Thank you so much. And to our viewer, tomorrow is another time to join us on NTA News 24 by 7:30 p.m. for another interesting edition of the program, Nigeria Today. Don't forget you can watch this edition of the program alongside others on www.youtube.com/NTA News 24 Hub. I am Lydia Odijochi. Merry Christmas and a Happy New Year in advance. Good evening.